I'm Dr. Maria Rivera, physician for the Nutrition and Chronic Disease Prevention Division at Harris County Public Health. With nicer weather in our area over the last week, it has been very challenging not to go out and participate in the activities we enjoy. With that said, we want you to safely do these things while being COVID-19 conscious. In Harris County, we are beginning to see a slight increase in our COVID-19 positivity rates and other trends. So it is important that we remain mindful that the pandemic is still ongoing and we must not let down our guards. One way to stay up to date with the latest virus statistics is to visit our COVID-19 dashboard. For Harris County, including the city of Houston, you can see daily counts on the number of confirmed cases, recovered cases, and COVID-19 related deaths in your area. You can also view the number of cases throughout Texas by county. Researchers at the University of Texas Health Science Center in Houston are partnering with the Texas Department of State Health Services to launch the Texas Coronavirus Antibody Response Survey, Texas Cares. Texas Cares will determine the proportion of people throughout Texas who have COVID-19 antibodies, indicating a past infection and possibly some degree of immune protection. For more information, or if you want to participate, their contact information is listed here. As you may know, the flu season is upon us again. A CDC analysis of flu hospitalization rates by race and ethnicity during 10 flu seasons from 2009 to 2010 through 2018 through 2019 showed that non-Hispanic Black persons had the highest flu-related hospitalization rates, and non-Hispanic American Indian or Alaska Native persons had the second highest. In addition, a 2011 study found that Hispanic or Latino persons were more likely than non-Hispanic white persons to be exposed to flu viruses because of the jobs they often have, which means interacting a lot with the public, or because of crowded living conditions. Now more than ever before, it is important to get a flu shot to avoid the risk of being infected with flu and COVID-19 at the same time, especially if you belong to an ethnic minority group. New studies show that SARS-CoV-2, the virus that causes COVID-19, can survive on human skin for up to 9 hours, as compared to the influenza A virus that lasts for a little less than 2 hours. These findings highlight the importance of frequent hand washing and good hand hygiene, which we can all agree is key to reducing the transmission of COVID-19. Just this week, the Centers for Disease Control, CDC, expanded the definition of a close contact. The agency now says that anyone who has spent a total of 15 minutes over 24 hours within 6 feet of an infected person will be considered a close contact, and therefore at risk of catching and spreading COVID-19. The change could have a large impact on schools and workplaces, where such contacts are hard to avoid. Finally, if you've gone into the store lately, you can't help but see the Halloween items on display. So what does a safe Halloween celebration during COVID-19 look like? Well, it begins with the fundamental preventive measures of wearing a face mask, keeping your distance from others you don't know, avoiding crowds, and washing or sanitizing your hands. We know that COVID-19 is spread primarily through the air in the form of droplets or aerosols. The good news is that when you are outside, the fresh air disperses these droplets and aerosols. So if you plan to participate, stick with outdoor Halloween activities. And again, we want to remind you about the free COVID-19 tests provided by Harris County and our health partners. The test is free, the results are fast, and the testing locations are convenient. Log on to hcphtx.org to register, or if you do not have access to the internet, you can call 832-927-7575, and one of our intake specialists will assist you. Thank you for tuning in to HCPH's Weekend Review. Be safe, be COVID-19 conscious, and remember our motto: don't guess, take the test.